Welcome to Washington Hospital Today, dedicated to informing residents about healthcare topics and issues. Through programs featuring community forums and free health and wellness classes, our goal is to empower community members with the information needed to make informed health decisions. Washington Hospital has been providing healthcare to the residents of the Washington Township Healthcare District for the past 60 years. Today's presenter is Dr. Timothy Ortlip. Dr. Ortlip is an Otorhinolaryngologist.
Hey everyone, how's it going? Thanks for coming out tonight and joining me on this Thursday night to learn a little bit about some sinusitis. Talking about some general principles of rhinitis and sinusitis. I don't have any disclosures. And as they mentioned, I didn't know they were going to give such a great introduction, but I am from Philadelphia, Pennsylvania. Not born there, but raised there for most of my life. I attended Thomas Jefferson for medical school, which was 4 years, and then went down to Maryland at University of Maryland and the Shock Trauma Center down there. Spent 5 years there doing my training, a lot of reconstruction surgery for trauma, head and neck cancer, and also sinus problems. And then I went back up to Philadelphia to do a one-year fellowship purely in reconstructing the face. People, again, who had trauma, head and neck cancers, also some cosmetic surgery as well. We do a lot with the nose and sinuses as facial plastic and reconstructive surgeons. I also spent some time doing microvascular reconstructive surgery, meaning we do basically transplants from certain parts of your body to other parts of the body where that tissue is needed. Like to golf and snowboard, we travel. I have a wife and a newborn baby girl, so she's taking up a lot of our time now too. It seems to be a popular topic in California just because everyone likes to be outside. And there's so much agriculture around here, and that leads to dust and allergies and people getting all that stuff in their nose and sinuses, which can lead to symptoms. So we're going to go over some general anatomy, define the differences between the nose and the sinuses. We're going to discuss some of the more classic symptoms that one might experience if you have rhinitis or sinusitis. I also want to forward enough information to you so that you feel confident going into the pharmacy and knowing which medications you can try on your own should you be experiencing some of these symptoms. Finally, I want you to know when you should be seeing an ENT or even your primary care physician and what you can expect during that visit. So what are the sinuses? They're air-filled cavities in the front of the skull, and they serve several purposes. One is that they make the skull lighter. They're hollow, so when they're lighter, it relieves a lot of stress and tension on the neck muscles. Secondly, they also act as airbags, if you will. So if you encounter any facial trauma, the sinuses take the majority of the force and they buckle under the pressure to reduce the amount of force transmitted to the brain, because the brain is more important, obviously. The sinuses are lined with a pink soft tissue called mucosa, which secretes mucus into the nose for purposes of moisture and protecting our nose and our airway from different offensive agents which we find in our environment. There are four major groups of sinuses: the frontal sinuses, which are in the forehead and green; the ethmoid sinuses, which are in between the eyes; the maxillary sinuses, which are in your cheekbones; and also the sphenoid sinuses. This is just the side view. So again, frontal, ethmoid, maxillary, and then the sphenoid sinuses. They're all connected to the nose through tiny little pathways that allow them to be aerated, and they allow the mucus to drain into the nose. One key point that I want to make is that while the sinuses are connected to the nose, they are an entirely separate entity and are often confused for ailments that affect only the nose. And we'll elaborate on that a little bit more. So first we should talk about some more anatomy. So this is the nose, which is the entry point into the nasal cavity and the sinuses. The inside of the nose is composed of the nasal septum, which this is the side view. The nasal septum is made of cartilage in the front and bone in the back. The purpose of the nasal septum is to give projection to the external nose that we see and also to separate the left and the right sides. On the lateral nasal wall, which is kind of on the sides here on both, you have these three finger-like projections, and they're called turbinates, okay? And those turbinates, the purpose of those are to humidify and to filter the air that you breathe through your nose. And a lot of times those are the cause of a lot of problems that people have through their nose. So we'll touch on that very soon. To understand what can go wrong with the sinuses, it's important to understand how they function. So normally the sinuses are lined with the mucosa, which contain little tiny hairs, and those hairs help facilitate the movement of the mucus up and out of the sinus. So this is the maxillary sinus here. Your eye would be right here. This is the nasal septum. It's kind of a magnified view, if you will. This is one of those turbinates that we talked about. This is another one of those turbinates. And as you can see, this sinus, the only connection to the nose is this tiny little passageway, and it's going up, which is kind of against gravity. So all the tiny little cilia are actually moving the mucus around and up into the nose, okay? And we'll touch base on this again as well because this is an important slide. Stasis or any inflammation inside the nose, whether it's the turbinates, whether it's this little area or in the sinuses, can cause obstruction of this tiny little outflow tract. And when there's obstruction there, it's like a big traffic jam for mucus. So mucus gets backed up, and that causes stasis, and that also causes harborization of different types of bacteria and microorganisms. So now that we have a little bit of background on the anatomy, we can use that as a roadmap for the rest of the discussion. You know, what I hear a lot in my clinic is, I have a sinus infection. And I think for the majority of patients, they certainly do. But often this term sinusitis gets thrown around. And part of this discussion is so that we know exactly what we're talking about and we can talk intelligently and communicate what problems we're having better when we see our doctors. So that phrase can mean a lot of different things. Some people, it means having a headache. Some, it means having facial pressure, nasal congestion, cough, itchy eyes, teary eyes, sneezing, and any of the above. Most people that say they can't breathe through their nose or always feel that they're stuffy or they have pressure around their nose. But others, like I said, have full-on headaches and even fevers. And as I mentioned, the term sinusitis to patients could mean a lot of different things. So we have to go through a differential diagnosis and try to figure out, you know, is what the patient's saying matching up with sinusitis or not? Because a lot of times these headaches can turn out to be migraines, different types of headaches, nerve problems such as trigeminal neuralgia. Even people with bad dental infections can sometimes have issues with their sinuses or around their sinuses and present as sinusitis. And again, as I mentioned, rhinitis, just inflammation of the nose, can often present as quote-unquote sinusitis. Sometimes people don't have infections at all. Sometimes it's just their septum's deviated to one side and they can't breathe. So, you know, they think they have infection because they can't breathe, but it's really just a structural abnormality. Reflux from the stomach. You know, when you're laying down, sometimes that reflux comes up all the way into the back of the nose and causes inflammation and irritation. And last but not least, and certainly not a comprehensive list, but nasal masses, tumors, benign and malignant, stuff that we wouldn't want to miss, okay? So, a big part of figuring out the diagnosis is distinguishing the problems of the nose from the problems of the sinuses. Most of the time, patients who think they have sinusitis also actually have something called rhinitis. And so, rhinitis, in its simplest definition, is inflammation of the nose. Inflammation in the nose causes swelling and enlargement of the lining of the nose and subsequent difficulty breathing and congestion. As you can see in this picture up in the upper right. On the right side, so just a little background, when we talk right, we're looking over here because it's as the patient's turned around. So patient's right side, patient's left side. So on the right side, the turbinates look nice and thin. There's plenty of room for airflow. in the nose, and this is all just big ventilation system. Whereas a patient with rhinitis, the turbinates get really inflamed and they get big and boggy and swollen, and that takes up a lot of the real estate in there for airflow, okay? And it causes the outflow obstruction of the sinuses that we talked about. This is most commonly caused by irritants such as allergies, dust, pollen, pollutants, any chemicals. Every now and then viruses, bacteria, and fungus can cause this as well. The nose will sense these irritants and react by secreting mucus, okay, to help try to rinse the offending agents out. So that's why you get runny noses when this happens, because your nose doesn't like what's in there, all right? That presents as like postnasal drip or just constant runny nose. You're always having a tissue in your nose, right? So down here, this is what we would see on a fiber optic view if we looked inside the nose. And this is normal over here. And so the S is the nasal septum, and then the I is the inferior nasal turbinate, so this thing right here. And as you can see, there's a lot of room there, but if it gets inflamed, it gets a lot bigger and encroaches on that septum and secretes mucus, and the mucus gets all stuck up in there, and then you're in our office. So the treatment for rhinitis will vary a lot depending on exactly what's going on, but overall it's very similar to the treatment of sinusitis. So we'll touch back on that towards the end of the talk. The second most common cause of nasal congestion and difficulty breathing is the deviated septum, which we did briefly mention. We talked about how it's made out of bone and cartilage and how it separates the left and the right side of the nose. Sometimes the septum naturally grows a little crooked. Sometimes people get clocked in the face with a football or, a punch from their sibling. For whatever reason, they present with unilateral or bilateral nasal obstruction. Usually, and you could also see compensatory growth of the contralateral nasal turbinate. So it doesn't show it in this picture, but if that's curved over to the patient's right, this turbinate will fill that space and become even bigger, compounding the problem, because you think, oh, well, they got plenty of space here for breathing. No, that thing doesn't like to be small, so it will grow. And here's actually a pretty good example of that. As you can see, this is a CT scan, a big X-ray of a patient's face, right eye, left eye. These are the ethmoid sinuses that we talked about. These are the maxillary sinuses, the ones in the cheekbones, okay? Right here in the middle is the nasal septum. And as you can see, it's a little S-shaped. So, this patient had a lot of difficulty breathing on that left side, but as you can see, the right turbinate fills that space. So if you're only thinking it's one problem, it's usually two. So now that we're through the nose, which is the entryway into the sinuses, we could just discuss what sinusitis is. And again, in its simplest form, sinusitis is just inflammation of the sinuses. Again, caused by a lot of the same things that cause rhinitis. It's just kind of walk through the door, and now it's in all the different rooms, right? So we're talking allergies, dust, pollen, whatever, dog hair. The problem with the sinuses is that the inflammation that occurs causes obstruction, and this is that same picture before, and causes this obstruction in this tiny little road. So I like to kind of talk about the nose as a big highway. This is all a ventilation system, but if the nose is a big highway and these are the little neighborhoods, these are the tiny connecting roads or the exit ramps. So if there's a traffic jam here, you have a lot of backup here, okay? And that'll be important when we talk about what we can do to relieve this problem with surgery. If you have sinusitis, you're not alone. It's a very, very common ailment. It affects 1 in 8 adults. The cost to the medical system is exceedingly large and exceeds $11 billion a year, and that's just for direct medical costs. That's not accounting for you being absent for work and having to keep the kids at home and all the other intangible effects that it can cost you. And it's a very common reason for why anyone would be prescribed antibiotics. I think it's in the top 5 reasons. It comes in different flavors too. So when you talk about sinusitis, there are acute versions, and there are chronic versions. So acute sinusitis tends to be a little bit quicker onset, more intense. It often presents with purulent drainage through your nose, pain, fevers, eye pain, etc. Typically, these are caused by microorganisms such as viruses, bacteria, or both. And generally, symptoms are bad enough for you to want to see your doctor. Likewise, we differentiate this from chronic sinusitis, which typically lasts for more than 12 weeks. You can experience the same symptoms as acute sinusitis, but usually they're a little bit less severe. They could be intermittent, waxing and waning. This can also be caused by microorganisms, but is usually caused by just a general overall inflammation from some sort of allergy. The treatment for chronic sinusitis is a little bit different from acute in that the use of antibiotics should be a little bit more judicious because it's not always microorganisms that are causing the problem. So you start experiencing these symptoms, it's important to start treatment as soon as you can, and oftentimes it can be difficult to get in to see the doctor. So it's good to know what kind of medications are available to you over the counter so you can get an early start or at least prevent it from getting worse by the time you do see a doctor. The problem is it can be quite confusing when you go into the pharmacy to know what to use and how to use it. So we're going to go through some of the more common over-the-counter medications and explain how they can help. It's also helpful for you to try these medications prior to seeing your ENT doctor to give us a better idea as to what you know and also what you've tried and what works and what doesn't work. The first of which, and this is a big staple of treatment, is just nasal saline. A lot of people scoff at this because they're like, oh, I want antibiotics, I want medications, I want drugs. But nasal saline is probably one of the most effective things you can do to get rid of this problem, especially for chronic sinusitis. Basically what it does, it's just salt water. It's like the stuff you put your contacts in, and it helps rinse out any crusting, any debris, any particles, any pollen, dust from the nose, because when it sits in there, it's not doing you any good. It's just causing inflammation, and you're breathing that stuff in all day. So if you could rinse it out, it provides a nice moist environment, a nice clean environment for the nose, okay? It doesn't work right away. It's something that you have to kind of incorporate into your habits, just like brushing teeth. But the people who do it, and they do it religiously, they love it because they feel really good afterwards. And it's more of a preventative thing, but it should be incorporated into treatments if you do have sinusitis as well. These are just some of the common products that you might see on the shelves. All very similar, it's all just saline. I generally like this. I'm not sponsored or anything by that, but this typically seems to work. These two are made by the same company. This is Neti Pot, which I'm sure a lot of you people have heard about. This one is more of like a squirt bottle. But overall, for all intents and purposes, same thing. This one is a little bit more milder, so if you can't handle the intense, flushing of an irrigation, I know when I get water in my nose, it kind of burns. This is a little bit lighter, and I tell people who can't do the full-on flush, as long as you're getting some in there to the point where it's dripping out, you're getting some of that stuff out, because the dust, while it does go everywhere, most of it just collects right in the front. So if you could just even get a little bit in there and get it dripping out over the sink, that's pretty good. Make sure you use clean water. There are cases where people are using dirty water and you're just kind of sending that bacteria right into the place where you don't want it. Also, it kind of helps if you warm it up to like body temperature, so that way you don't you give yourself brain freeze or something like that. I've seen it. The second staple in treatment are just topical nasal steroids. And again, these are all over the counter. You can get them at any pharmacy. This one probably costs anywhere from $10, $15. These are designed, this is nasal spray, it's designed to coat the lining of the nose and reduce inflammation and rhinorrhea, which is runny nose. They're safe for long-term use, and they're not addictive. As with most of these over-the-counter medications, in general, they're fairly safe, okay? You do want to check all the warnings and contraindications, and if there's any questions, you should consult your physician. But the key to Flonase or Nasacort or any of these nasal steroids is that you have to use them every day, and a lot of people don't like that or they don't understand that, but it's not an as-needed drug. Many people come into my office and they say, yeah, I tried Flonase for a couple days, it didn't seem like it worked, so it's sitting on the shelf. Or, hey, I tried it for a full week, but it didn't work, so it's sitting on my shelf. But the issue and the key to these nasal steroids is that it takes a couple weeks for them to kick in, okay? And you got to use it every day. So if you could tolerate that, generally it's a very great solution to, it's a great long-term solution to decrease the inflammation in your nose, okay? Some other issues with these medications are if you're spraying it in your nose and you're hitting the same spot every time, sometimes it thins out the lining of the nose and can cause a little bit of bleeding. So you want to watch out for that. If you have problems with bleeding or epistaxis, definitely consult your physician before you start using this. If you have any eye problems, in particular narrow angle glaucoma, definitely a contraindication to using this medication. So if you're unsure, just consult your physician, okay? Next, antihistamines. This is actually something that many are familiar with, Benadryl, Claritin, Allegra. This is very good at counteracting allergies and the symptoms that are associated with allergies. It works by preventing the release of histamines, which is the mediator in the allergic reaction. So it helps reduce the swelling, the itching, the itchy, teary eyes, the sneezing. They come in a lot of different forms. Some are daily forms, some are non-daily forms. So generally, I'm okay with people starting on the non-daily, trying out for a week or so. And if it helps, great, then we could switch you on to a daily form. And a lot of the use of these will revolve around the times of the year where you're feeling your symptoms most. Some people it's in the spring, sometimes it's in the fall, depends on where your allergies are. And so you don't have to be on it all year, but rest assured, if you're having spring allergies, I know I do, I start my Claritin, right before I start getting symptoms, and I'm on it for basically all spring. I added this, Mucinex, you probably heard of it. It's a mucolytic, which means it breaks down the mucus. These are good for people who have really thick mucus and it's not coming out, or they just feel really, crusted up. What it does is it helps facilitate the saline rinsing it out. So not much else to say about that. The big one are nasal decongestants, okay? And we're going to spend a little bit of time on this slide because there's a lot to say. These come in the form as you've probably seen, Afrin or oxymetazoline is the active ingredient, neosynephrine, Sudafed, okay? Or any medication that has a D on the end of it, Claritin D, Zyrtec D, those all have decongestants. D is for decongestant, okay? These are the ones you need to use judiciously, all right, because they can be very dangerous. While they work well, how they work is they constrict the blood vessels in your nose. And so when you have swelling, all the blood vessels are very dilated and leaky. So these will medically constrict the blood vessels and shrink the swelling in your nose. And it works so well, it's very responsive. So usually within minutes to hours, you're going to get good relief, okay? As I said, they're fast acting, they create a dramatic difference, and people really love it. They become addicted to it, not in a physiologic sense, it's just they love the feeling. It's the only thing that works for them. So they continue to use it. The problems are twofold. One is they can increase your blood pressure because especially the oral ones, these are nasal sprays, so they don't get as absorbed into your system, but the oral ones, if they're constricting the blood vessels in your nose, you can be sure that they're constricting the blood vessels in your heart, in your lungs, in the legs, and everything else. So it raises your blood pressure. You want to be aware of that. If you have hypertension, definitely check with your doctor before you're on these long term, okay? Other problem that it could lead to is something called Rhinitis Medicamentosa. basically this is a condition of rebound nasal congestion brought on by extended use of topical decongestants. So after a while, it will make your nasal congestion a lot worse, okay? And it's a very difficult condition to treat. I see probably 2 or 3 people a month that come in and they're saying, I was on Afrin for about a month or 2 months, and I'm just like, that's 2 months too long, because you're only supposed to use Afrin or neosynephrine for like 3 days, okay? The decongestants are very good at kind of jump-starting, your healing, but definitely not good for being on for long term. Unfortunately, there's no great treatment for this other than just stop using it cold turkey, and people hate that, but you have to know it's just going to get worse before it gets better. You stop this and then start the other stuff like the saline, the Flonase, and sometimes we can bridge that gap with some steroids, like some oral steroids, but that's on a case-by-case basis. So these products aren't working for you. You think you might need some help. When should you see a doctor? So rest assured, the answer is you could come see us anytime. We're always here for any questions, any concerns at any point in your ailments. But in general, you should come sooner rather than later. If you have severe symptoms, obviously, get in to see someone as soon as possible. You may need antibiotics. But if you're diabetic, immunocompromised of any sort, these can make infections a lot more difficult to treat, and they could make them a lot worse in terms of their longevity and their symptoms for you. When you come see us, be sure to have a list of all the medications you've tried, if you did try some, and tell us as much about your symptoms as possible. As soon as you step in our office, we're now a team, and we need to try to figure out how we can get you better. So sometimes it can be hard to make a distinct diagnosis of sinusitis, so we depend a lot on what you tell us in terms of the timing, how long, when did it start, what have I tried, what makes it better, what makes it worse, all of that. And even if we get a good history, the prevalence of sinusitis ranges from about 65 to 80% of all the patients that we see with this problem. So oftentimes it ends up just being inflammation of the nose. We may want to offer a procedure called nasal endoscopy, or even need to get a CT to get a better idea of what's going on with the sinuses. So nasal endoscopy is an in-office procedure. It takes about 5 to 10 minutes. We use a small fiber optic camera, and we could take a look inside the nose and check for any inflammation, structural abnormalities, infection. In general, it doesn't hurt in most people, and they don't need any kind of anesthetic. So this is just an image of a patient getting the procedure done in the office, and this is what we see through the camera or the tiny little hole in the end. And what you're looking at here is, this is the septum again, this is the inferior turbinate, and this is the middle turbinate, and this asterisk is just a whole bunch of bacteria and purulent drainage coming out of the maxillary sinus. So that's the kind of stuff that we're looking for, so we can guarantee a diagnosis of bacterial sinusitis, and we can get you on the appropriate antibiotics. We may want to take a culture of that in the office and send it off so we know which antibiotics to put you on. And again, I mentioned we may want to get a CT scan depending on your symptoms and how long they've been going on. This is basically a high-resolution series of x-rays which allow us to see the three-dimensional anatomy of the nose and the sinuses. So as we looked at one earlier, but as you can see on the right side here, this is the patient. White is bone, black is air, gray is everything in between, so brain, eyeballs. This is a normal CT. This is what it should look like. The nasal septum in the middle is nice and straight. The turbinates are pretty minimal. There's plenty of black air flow on both sides, and as you can see, there's no gray or inflammation in the sinuses that we can see, and the outflow tracts are nice and open, okay? In contrast, on this side, this is a patient with very bad sinusitis. Similar view, eyeballs, brain, bone. Septum's pretty straight, but as you can see, there's, it's all grayed out. This should be filled with air, and that should show up as black. So this patient has very bad sinusitis, maybe some nasal polyps or some kind of inflammation that's blocking all this mucus and bacteria from exiting the nose and draining into your throat, okay? So if it turns out that a patient does have pretty bad sinusitis disease, there are numerous ways to fix it, but you should know that it isn't always a quick fix. A lot of times the inflammation that has been going on for a long time is going to take a while of the right treatment to get rid of that same inflammation. We may even have to modify your environment or remove any potential allergies or environmental sources which are causing the irritation, but it's important to know that you and your doctor, again, are working together and usually in a series of visits to see what works, what doesn't work, and try to maximize your medical therapy and to avoid surgery if possible. And this is busy, but I didn't intend for us to go over all this, but this is kind of the algorithm that doctors go through when we try to sort through what you're telling us and figure out what's going on. So, possible sinus infection, how long has it been going on for? Less than 4 weeks, more than 4 weeks. So when we ask you all those annoying questions, it's usually for a purpose and not just to be annoying. And, it comes all the way down to surgery, which is kind of the end result. On to the treatment. So overall, for any type of rhinitis, inflammation of the nose, or acute or chronic sinusitis, the mainstay of treatment is going to be your saline irrigations, your nasal steroids, and pain medications if needed. If you're really congested, you can do a trial of the nasal decongestants, with the cautions that we talked about. And that should help facilitate or jumpstart that decrease in the inflammation and getting the ventilation back through your nose, okay? Acute sinusitis that does not initially respond to those types of treatments may need an additional antibiotic, okay? And that antibiotic is usually in the form of a penicillin-based antibiotic for generally 5 to 10 days, or a fluoroquinolone like levofloxacin, ciprofloxacin for generally 10 to 20 days. Sinusitis, which tends to be more indolent, long-lasting, may be caused by other factors other than microorganisms. So it's important for us as doctors to elaborate on your medical histories, to make sure there aren't any comorbidities such as asthma, cystic fibrosis, granulomatous diseases, which may be contributing to the overall sensitivity of the nose and inflammation of the nose. Up to 84% of the time, chronic sinusitis is caused by allergies which congest the nose and obstruct the outflow tracts. So antibiotics aren't always warranted, and it's more of a treatment for the allergy that's going to help. Additional treatments can be added by your physician based on specific symptoms. So these are just some other medications which you may come in contact. These are all prescription based, but anticholinergics. So this is a nasal spray, and this actually works very well for people who just have recurrent rhinorrhea, runny nose. They're all day, and they feel like they have a tissue in their nose all day. Even if they're not having any nasal obstruction, I find that this works very well. It's a nasal spray. You just spray it in each side of the nose up to 3 times a day. This is an as-needed drug, so you don't have to take it if you're having a good day. And people generally really like this. The problem with this is similar to that of Flonase. You have to watch out with if you have any problems with your eyes, such as glaucoma. It can also do its job too well and dry out the nose and cause bleeding. Mast cell stabilizers like cromolyn sulfate, these come in different forms such as nasal sprays or pills. And these are similar to antihistamines in that they try to stabilize your mast cells, which are part of your immune system. They are responsible for releasing the histamine in the allergic reaction. And by decreasing the release of a histamine, they prevent all the subsequent symptoms such as swelling, itchiness, etc. The problem with mast cell stabilizers is that they're more of a preventative thing. So, generally people don't think to take them if they're having a good day, and it's not until after they start getting the allergies then they're like, oh, I should have took them. So these are also safe in pregnant women as well. Leukotriene modifiers. These are medication that's used to decrease something called leukotrienes, which is another inflammatory mediator. You find this a lot in people who have asthma. So if you have a history of asthma, this may also be something that might help decrease the inflammation of the nose, because the lining of the nose is very similar to the lining of the throat and lungs. Okay, it's all one unified airway. So generally what works for asthma in the lungs, or what's causing asthma in the lungs, can cause problems in the nose and sinuses as well. And last but not least, if we even get to this point, we do allergy testing. We try to figure out exactly what it is that's causing all your sneezing and all your itchiness. And if we could identify that, and it's possible to remove that from your environment, then that's something we could do. Also, you could do immunotherapy, which is desensitization, and so the allergist will introduce small aliquots of that exact allergen into your bloodstream so your body gets used to it. They do it a lot with kids with peanut allergies. It's a desensitization so that they can enjoy peanut butter like the rest of us. But this is something that I will order for people if they can specifically say, every time I'm around dogs, I just, ugh. So, or I'll order it if we can't get any control of their symptoms. A lot of times it'll come back, I'm positive for trees, grasses, cars, sidewalks, everything. So it's also a double-edged sword in that nature. As we move on to this kind of final portion of the talk, I wanted to highlight just a general principle when it comes to nasal obstruction and congestion. And we did kind of briefly touch on this earlier, but when it comes to the nose and sinuses, we talk about structural problems and we talk about inflammatory problems, because both can cause similar symptoms in nasal obstruction, difficulty breathing through your nose. But most of the talk up till now has been about inflammatory conditions, sinusitis, itis, right? So inflammatory conditions right here are generally treated with medications, okay? There's no amount of surgery that's ever going to take out all the lining of the nose and, make it so it doesn't swell up, right? That's all just how your body reacts to your environment. But on the flip side, we have structural problems in the nose. And so we talked about the deviated nasal septum. There's no amount of medications that's going to straighten out that bone and straighten out that cartilage, right? Only surgery can get that straight. So we talk about the deviated nasal septum, which we see here. We talk about large turbinates. Turbinates are a little bit of both. Sometimes people could just have really big turbinates, or sometimes they have small turbinates with a lot of swelling. So turbinates kind of fall in both categories, but nasal masses, which we'll take a look at, something called a Concha Bullosa, which is very common as well, we'll take a look at. And of course, if you're looking at little kids or even not little kids, you have to consider foreign bodies. People are always sticking things in their nose. So here we revisit the deviated nasal septum, same picture as before. As you can see, there's not much going on in the sinuses. Here's the outflow tracts for that sinus and that sinus. But like I said, he's going to have trouble breathing on this side. He's going to have trouble breathing on this side because of that. So this guy would be a good candidate for something we call septoplasty and turbinate reduction. And that's an outpatient procedure, and it takes about, maybe for this patient, 2 hours, something like that. And what we do is we gain access to the nasal septum through the nose, and we use special instruments and or surgical techniques to just completely straighten this out, okay? What we also do is trim down these turbinates. We don't get rid of them, you need them, but we trim them down and scar them down so that they're smaller, they're less reactive, and they don't secrete as much mucus. And usually the combination of those two will get you breathing pretty good. And when you're breathing pretty good, then everything's nice and aerated and you don't have any, mold or residue growing. People can have nasal polyps as well. Nasal polyps are basically a manifestation of just chronic inflammation in the nose. When that inflammation is so bad, it starts organizing into solid masses and it looks like these grapes. These are notorious for causing nasal blockage as well as sinus blockage and difficulty smelling. People will come in and say, I lost my sense of smell, I lost my sense of taste. Sometimes people will say, it feels like a ball valve in my nose. Like when I breathe out, I feel something go out and then breathe it back in. It's like a big permanent loogie, right? And so as you can see, this is the turbinate, and this is exactly what they look like. Little white grapes with little blood vessels on them, and they come out of underneath the turbinates. The only way to get rid of these is through surgery, all right? Sometimes you could shrink them down with steroids, but if it's bad, you can pretty much bank on but a good option would be surgery. And what we do is we basically go in and bloop, just pluck them out. The problem is, even if you get them all out, they can come back, okay? If you don't control the inflammation medically afterwards, they can come back, okay? So not only are you looking at surgery, but you're looking at a good maintenance program of saline, nasal steroids, and frequent checkups by your doctor to make sure that they don't come back. And if they do, and you catch them small, it's a lot better than if you catch them big, okay? It means a lot less surgery, so frequent checkups is definitely recommended. This is the Concha Bullosa that we talked about. It's an air-filled middle turbinate. So if you look on the patient's right side, this is the middle turbinate on the right side. But this turbinate on the left side is filled with that black cavity, which is air. And that's a congenital malformation, or it develops as the turbinate develops. And the problem with this is obviously it's big, it's obstructive, but it pushes the septum over too. So it causes problems on the contralateral side as well. The only way to fix this is surgery. There's no amount of medication that's going to get rid of that. And so what you do is similar to the other patient. You do the same thing, septoplasty, fix the septum, but before you do that, you got to get rid of this. And so what we'll basically do is just take scissors and trim it right here and trim it right here and just take out this segment. Push that over so that way you still have a middle turbinate, and then everything else can fall over. Most importantly, we don't want to miss a diagnosis of a nasal tumor. While these are rare, they can present as unilateral or bilateral nasal obstruction and bleeding. If they obstruct the sinuses, they could cause sinusitis, they can cause difficulty smelling and difficulty with your taste. But treatment for any type of nasal tumor is going to depend largely on the pathology. So if this is found on nasal endoscopy in the office, we're probably going to need to numb it up a little bit and take a little piece of that tissue so that we could send it off to pathology, look at it under the microscope, and see exactly what's going on, okay? This one in particular is something called inverted papilloma, which is basically a big wart in the nose. It's caused by a virus. In general, it's non-cancerous, but it can recur. But under the list, you can have malignant tumors, sinonasal cancers, metastatic disease, lymphomas, little outpouchings of brain can come down, or just big balls of mucus. So if you are a patient with sinusitis and you get to this point, it's not to worry, because generally sinus surgery is very safe, it's well tolerated, it's not very painful. If you look at the broad spectrum of all the surgeries, this is definitely way down on the kind of like, I'll get to it when I can, it's not that emergent. But the goals of surgery are to establish a patent open nasal airway and relieve the sinus outflow obstruction, which we've been harping on this whole talk, to decrease the overall inflammatory load. When you open up the sinuses and straighten out everything and create room for ventilation, that also creates room for drug delivery and saline delivery. If you have a crooked nose and you try to squirt some saline in that one side, it's probably not going anywhere, it's just going all over your face because it can't get all the way back there. So sometimes you need to straighten out the septum just so that you can get the medicine back to where it needs to go. And obviously minimize any risks or adverse outcomes, okay? The surgery is generally done as an outpatient, where we use fiber optic cameras and intranasal instrumentation to navigate through the nose and access the sinuses. Everything is done through, well, for the sinuses, everything is done through the nostrils. So there's no scars, there's no incisions. As I mentioned, it's not very painful and there's minimum downtime. While it is a generally safe procedure, every surgery has its risks, and that ranges from bleeding, infection, to I don't know if you noticed, but the eyeballs are right there, the brain's right there. So a lot of times we use intraoperative navigation, which is a CT scan that shows us exactly where our instruments are real time. So that way if there's any question about things, especially in revision surgeries, we could refer to the CT scan and say, oh, I shouldn't go any further because that's the brain. In general, we don't really need it if it's a primary surgery because, that's what training's for. But since it's so accessible and basically every outpatient surgery center has one, we just use it. So here is schematic. On the right side, this is kind of, think about that CT scan. So maxillary sinus, inferior turbinate, septum. There's this wall here that's called the uncinate process, okay? And then these are the ethmoid air cells and some of the middle turbinate. And when we go in for surgery, and I'll show you a little video in a minute, we go in and we basically take this wall down. And by taking that wall down, it opens up this maxillary sinus a whole lot. So instead of having this tiny hole that when it gets inflamed, it turns into nothing, now you have a big hole, a big pathway, that when it gets inflamed, it turns into a tiny hole. So it's still open. And then these ethmoid air cells, we kind of take down all those little septations that we call like eggshell bone, because it feels very much like eggshell. And we just open up all those sinuses so that way they have direct access to the nose. And so this is a CT scan of someone who has had a very successful sinus surgery. As you can see, there's that uncinate process, which was right here, is no longer gone, and now they have a big outflow tract on both sides. Middle turbinate's right there, it's nice and thin. Ethmoid sinuses and frontal sinuses are wide open. And this guy probably has NASCAR going through his nose because it's so open. So this is a short video to kind of give you guys an idea of what it looks like. It is not an entire sinus procedure because that would take about 2-3 hours, but this is what the maxillary enterostomy looks like. So the turbinate, this is the patient's left side, so the middle turbinate's right there, and the surgeon is kind of medializing that to gain access to the maxillary sinus, which is over here. The inferior turbinate's going to be down here, okay? So once they get that lateralized, this thing right here that they're looking at is the uncinate process. That's that little tiny bone that we removed on those pictures. And so they're making a small incision on that uncinate process. And then, as you'll see, they're going to go in there and just grab it, and we'll actually be able to see inside the maxillary sinus now that that's open. And during this process, they have to be very careful because right on the other side, if you go about a couple centimeters that way, that's the patient's eyeball. So this is the big piece of tissue. This is that wall. And they're just taking that out. And as they get the camera back in there, it's kind of hard for me to see, but if you look down in this area, you'll be able to see the room, the sinus, the maxillary sinus going right here. So now that that piece of bone's gone, that room is now, turns from a window to a door. Despite surgically opening up the sinuses, sometimes patients still have recalcitrant inflammation, because as we mentioned before, inflammation cannot be 100% treated by just surgery alone. So a lot of times there's going to be some maintenance even after surgery to kind of decrease that inflammation, and those are the same medications that we talked about before. But more importantly, it's good to just follow up with your ENT doctor so that they could take a look inside your nose and make sure everything stays open, there's no scar tissue or any brewing infections. The complications, this is kind of the opposite side of things. If you wait too long or you kind of ignore your symptoms, I know me personally, I'm a little stubborn, so this could easily be me someday, but hopefully after this talk I'll know what I'm talking about. But as we looked on the other CT scans, the sinuses are right near the eyeball, so In the beginning, if that infection is bad enough and is not treated appropriately, and that all that pressure and inflammation builds up, it could spread to the eye and cause preseptal cellulitis, like this child right here. It could cause orbital cellulitis, where that inflammation extends into the eye socket. It could cause abscesses in and around the bone. This is an example of some ethmoid sinusitis that went through the bone, and now it's under the lining of the bone in the patient's left eye, and that sometimes requires surgery. Intraorbital abscesses as well, that just this extended further into the eyeball. But if it gets bad enough, or if you're immunocompromised or your immune system's not working well, it could go down into the brain. It goes back here into the cavernous sinus. It can cause meningitis. It can cause intracranial abscesses too. So definitely want to make sure that if you are experiencing any orbital changes in vision, neck rigidity, fevers, that you should see an ENT right away. And just to wrap things up, in conclusion, some of the bigger points here. One, rhinitis is way more common and very different from sinusitis. A lot of times what you're experiencing is often just rhinitis and can be easily treated with some of those over-the-counter medications that we talked about. You could try them. Definitely take note of what works for you, what doesn't, and then always consult a physician if you need to. We discussed how structural issues are treated with surgery, inflammatory issues are treated with medications, and that's a very important concept. And then surgery is, we don't like having to take patients to surgery, but if we feel like it's necessary, it is pretty minimal, pretty low risk. Definitely make sure you talk to your doctor, discuss all those risks in detail, go over your CT scan with them, try to understand exactly what they're going to be doing and what the expected benefits are going to be. And as always, you can find me at this address, phone number to our office. This is kind of the stuff that we do over in our office, so if you have any issues with those, I'd love to come back and maybe give a talk about any one of these issues if people want to hear about that. And thank you for having me.